Well, hello everybody, and welcome to September's Real Mushrooms for Pets Facebook Live. My name is Joni Kamlet, and I'm the director of the Pet and the Practitioner departments. And
And I'm Dr. Rob Silver, Chief Veterinary Officer for Real Mushrooms.
there you go. And we are doing this Facebook Live early. We usually do it the last Thursday of the month, but Doc Silver is getting ready to, and I are getting ready to embark on, a couple weeks of conferences and travel. If anyone's in the Chicago area, this Sunday, Doc Rob will be speaking at the Dr. Ruth Roberts event. But we're lucky to have you here before you're leaving. Are you hearing that? That's my back. That's just living in downtown Berkeley. Somebody set off a car alarm. But anyway, we're glad that you're, before you left on all your travels, you were able to join us again tonight, Rob, for a really important topic, which is pain management in pets. So do you want to start us off?
I do. Pain's a big topic. It's a very big topic, and it's probably at the top of every veterinarian's mind when you bring your animal in there. And when if you go in to see your doctor, they also ask you on a scale of 1 to 10, what is your pain? And that's probably one of the biggest jobs we have, is to make sure they don't feel pain. And unfortunately, because of aging, because of trauma, because of genetic deformities and everything else, many pets will have pain, as will many people. And pain isn't a simple thing to solve. It's not like just giving it one pill or finding a mushroom that works, because there's different types of pain. And there's different causes for each of those types of pain, and they manifest differently. So it's not like there's a simple answer. And in veterinary medicine, we've got a whole pain management institute. I know what the formal name of it is, but in it, they talk about the multimodal approach to pain. Multimodal means we're using a lot of different things to get to the same place. And this might mean that your dog who is on an NSAID, as much as you hate pharmaceuticals, the NSAID might be helping your dog get around a little better and not be as uncomfortable. And if they're panting a lot, it might not be the heat, it might not be anxiety. It could be a response to pain. I'm seeing a lot of panting and Ollie, my own dog, lately. I took him into the vet this week because I wanted to have someone else take an objective look at him. I have trouble being objective with him. So really we talk about a variety of different approaches, and there are a variety of approaches. Probably mushrooms aren't on the top of the list, but they are part of a nice lifestyle addition to help reduce inflammation. And there are a few mushrooms that have been shown in studies to have what they call analgesic effects. But these days we've got lasers, we've got these CC loops, this pulsing electromagnetic force, we've got the CBD and those kinds of approaches. And we've got acupuncture and massage and chiropractic. So there are so many different ways of approaching it. And I don't think there's any one specific way to go. I think finding the right blend that works for your pet, works for your budget, works for practitioners that are close enough to you that it doesn't become totally inconvenient to get your pet to them, is really the equation that you need to solve when it comes to pain. Yeah. So I'm ready. Let's talk about this.
Yeah. Thank you, Doc Rob. Yeah, I agree. Pain is it's a big deal. And it's, and then there's the whole wind-up syndrome with pain where, an animal can be painful. The more painful they are, the more painful they become, basically. I don't know if that makes sense, but, or if I'm saying it correctly, Rob, but it builds upon itself. And so it makes it harder to relieve that pain. So it's really important to get on top of it. And sometimes, like you were saying, it might take that NSAID or, just to kind of calm things down while you're looking at alternative, then moving to all the giant toolbox of alternative therapies that can be helpful for sure.
Exactly. And we discussed wind up with anxiety as well. And what it means is you want to do some kind of intervention before the pain gets bad, because as it gets bad, the perception of pain, makes it worse, because it creates this whole emotional response to pain. So yeah, it's good to be on top of that.
Yeah, absolutely. So let's take some questions. Actually, Carrie, I
Oh,
see what
wait,
I.
a disclaimer first. I
Oh,
forgot.
sorry.
Sorry,
Yes.
my disclaimer. Just wanted to say that I want to do my best to help you with your questions tonight, because we don't have a legitimate doctor-patient relationship, which means I'm not touching your dog and listening to its heart and taking its temperature. Um, I'm not allowed by federal law to actually give you medical advice, but I am allowed to give you educational advice. So I will do my best.
Thank you. Thank you for saying that and for the reminder.
Mhm.
Um, so the first question we have is, what should I give for sudden pain and accident versus chronic pain?
Excellent question.
Yeah.
Excellent, because they are different.
Yeah.
And, with sudden pain, with an accident, I would say looking at some intervention with a drug, of course, depending on how severe the accident is and everything else. We've got some very good NSAIDs these days that are sparing of some organ function. So we do have that ability. Using an opiate, narcotic, that can be very, very important as well. As far as conventional approaches, and I have to say that commonly, you're not going to see a lot of use of alternative complementary therapies in the ER, in terms of acute pain. There's different approaches, and I don't really think that looking at the use of a mushroom in an acute pain situation is going to be as effective as the use of some other approaches. And certainly acupuncture can be helpful for that. Chiropractic can be helpful. It depends on the nature of the pain, the source of the pain, what kind of accident and injuries we're dealing with. Chronic pain is different, and chronic pain does respond well to supplements, does respond well to lifestyle changes. Oftentimes, I find in my practice that the use of herbal therapies can be very immediate in its ability to get in there and do something with the pain. CBD, for instance, we know that CBD and THC, which is intoxicating and is illegal in some places, but nonetheless is around there. THC and can be dangerous in terms of too much to a dog, but THC actually can block some of the pain signals that we see with pain. Maybe THC might be used with acute pain as well, but CBD also works on the other side of the coin when it comes to pain, which is it reduces inflammation. So that's the best I can say.
And also, I would just add to that, that was a wonderful answer, Doc Rob. I would also add, it's important to have, depending on, with an accident, you probably have if it's a broken bone versus like a muscular strain or something like that, you might be looking at a muscle, something that's going to be more relaxing to the muscles as opposed to anti-inflammatory. There might be episodes where you're going to use heat as opposed, and other times where you're going to want to use cold instead. So it's important to, especially for sudden pain, make sure you get your pet to a vet to determine exactly what's going on. Chronic pain, that's a different story. It's you can kind of, the picture becomes kind of clear. You can tell a lot more by how, for instance, how the animal's moving. Are they limping? Are they dragging the leg? Various things that when it's a chronic condition. So I just wanted to add that.
Cold packs at first would be what I would use. And that'd be kind of a difference. With chronic pain, oftentimes we warm it up, because it gets so spasmed and contracted.
Right.
With acute pain, we like to use a cold pack. And if there's bleeding, then you want to do something to stop it, pressure or even a tourniquet, something along those lines.
Yeah, I actually had personally, I've been having a problem with my hip. My right hip. And I've been putting ice packs on it. And I went to my chiropractor and she's like, no, in this case, given what's going on, given what's causing the hip pain, you really want to use a hot water bottle instead. And I did that, and it made a big difference. But I always thought inflammation, apply the cold. And
not to confuse things, there also are chiropractors and other practitioners who will recommend alternating. Cold pack and then follow with a heat pack and then work on that direction. So
yeah.
a lot of approaches to get there.
Yeah, I guess with us, it's just we'll know, we can tell. But with pets, you just have to see, how are they responding to the cold versus the heat, etc.
Mm-hmm.
So yeah, the next question. So can pets with liver disease, as in elevated liver enzymes and bilirubin, consume healing mushrooms like Five Defenders? Does it help with bloating too?
So yes, absolutely. And the reishi in the Five Defenders, used alone or as part of the Five Defenders, has been studied to be beneficial for the liver in that kind of a situation. Now, what we have found now that we've been distributing mushrooms to a lot of dogs and cats is that some will react to the higher fiber that we see in mushrooms, which could promote bloating. So I would have to say that it's a very individual response, whether that would help or not. There are a small number of dogs that when you give them something like the Five Defenders, they may have more of a digestive system reaction and and so that's where my advice to start with a small amount and just get that gradually in there can adapt the dog better to that mushroom and avoid things such as bloating.
Yeah, great point. And of course, it's always just a good rule of thumb to start with a small amount and work up.
Always, yeah.
It also helps you kind of figure out what dosage is going to work. Sometimes
Mhm.
you don't need,
Yeah.
you can see the response with a smaller dosage, and you wouldn't have known it if you'd started with that higher dosage.
Yeah. I'd probably use herbs first. I'd grab an herb first when it comes to bloating. And my favorite herb is ginger. So that'd probably be where I would start. And ginger is good. It actually stimulates the stomach to contract and move digestive from down the tract. So ginger is not a bad thing to try. And you can get ginger in capsules, and that can work pretty well.
Yeah. Although I do love chaga as well for bloating. I've had, I don't know how it works with pets, but I've actually had some really positive experience. I know tonight's, I don't want to make tonight all about me and my issues, but it just happens to be that, yeah, I'm dealing with some bloating issues and digestion. And I was using the lion's mane because lion's mane is so good for digestion as well. But when I ran out of my lion's mane powder and I started putting the chaga in my coffee, and after a few days, I noticed a significant difference in the bloating that I was experiencing.
And going back to that question about Five Defenders, yes, it has the reishi for the liver and it has the chaga for the bloating. So yes, Defenders would be a good choice. Start slow.
So the next question, my 11-year-old female spayed golden had a mass removed. It was an oral melanoma with a high mitotic rate. We got slim margins. How would mushrooms be helpful to prevent it from coming back? Specific mushrooms, higher dose?
So yeah, a high mitotic rate oral melanoma is pretty aggressive. And I hope that they got it all. But yes, mushrooms would be helpful. Whether specifically for your pet, the use of mushrooms is going to stop it from coming back, I wouldn't be able to say that. And although I think any mushroom would work, we recommend the Five Defenders because it's a shotgun approach with 5 different mushrooms, all of which have been shown to have benefit for cancer in general. We don't have studies to direct us towards a specific mushroom for a specific diagnosis like that.
Yeah. If this questioner wanted to use a mushroom in addition to the Five Defenders, is there one that you would recommend on top of that?
Well, given that the mouth is the entrance to the digestive tract, I would maybe suggest more chaga, or we could add the lion's mane onto that as well in order to get a higher dose. But don't start with the higher dose, start with the lower dose and gradually ramp it up over a couple of weeks.
Awesome. Thank you. I want to give a shout out to Miss Kibbles, Claudia Montoya in the house. Doc Rob is going to be at her event, the Northern Virginia pet event. Claudia, if you wouldn't mind dropping your event in the chat, if you have a moment, we'd appreciate it. We're so excited.
I can't wait.
Yeah, Rob's going to be there exhibiting for real mushrooms. Karen Becker, Rodney Habib, Gosh, I can't remember. There's so many different conferences going on, but Claudia, you have such a great lineup of veterinarians, and you have Susan Thixton, who wrote The Truth About Pet Food and is like a pet food advocate,
Activist, yeah.
times 1,000. Yeah. So it's going to be a great event. It's sold out. But I think I saw this morning that maybe a little bit of a waiting list opened up. So yeah, I'm so bummed I'm not going to be there. But Claudia, I'm so glad that you joined us tonight. Next question from Carrie. Can I use the 5 Defenders mushroom powder made for humans on dogs too?
Of course, all of our stuff is very safe. It's very human grade. There's no fillers, especially, well, even in the human products, we have to use flow agents in our capsules, but in the pouches, it's just the pure mushroom. So yeah, absolutely no reason why you can't.
Yeah. And just to add to that, for anyone that's kind of new to using real mushrooms, the reason the pet line, as Dr. Rob said, it's the exact same mushrooms in the capsules as are in the human capsules, but the pet's version is smaller. It's a 300 milligram capsule as opposed to the what we call the human, or the large version, which is 500 milligrams, and it has veterinary dosages on the bottle. So if you have a smaller pet that you don't want to give that larger capsule, they work perfect for. Or sometimes people just like to see that it's veterinarian, that is safe. So we make the veterinary version. Yeah.
We actually have 4 different versions of the 5 Defenders that can be given to pets. We have the small capsules and the large capsules, as Joni said. We've got the bulk powder in the pouch, and we also have the soft chews, which have the 5 Defenders plus some herbs to help make it work better. So.
Yeah, and we actually have 5 because we have the pouch in 2 sizes, the small and the large pouch.
Okay.
So really, there's 5 opportunities to.
Yeah, because they're small, large. Okay. Yeah.
Oh, and you know what? We should. We haven't mentioned our discount code yet. We should probably do that. Thank you, Britta. So anyone that's listening, take a screenshot or write it down. You can get 25% off site-wide until September 30th by using the code PETLOVE25. So we'll announce that again later, but yeah, it's a great opportunity. Pamela's saying, yeah, I didn't realize there were chews. Yeah, we have 2 versions of our pet chews. We have the immune chews that Doc Rob mentioned that have the 5 Defenders, and then the relaxed chews, which is a calming chew containing reishi and lion's mane. Yeah, these are really beautiful formulas.
I'll get here in a second. There we go.
There you go.
It's everything's mirror image here. Anyway, that's it.
Yeah. And what do we get? We just got I just love that when people leave reviews on our website, we get a little ding. Our Slack, we've got a Slack channel for reviews, and so we get a ding. And I remember when a couple days ago, somebody who had 8 cats, and all 8 are obsessed with the immune chews of all things. And she said all 8 of them, she was totally surprised, but 8 out of 8 cats were eating the immune chews, which
that's awesome.
I know. I was so happy to see that. Okay, the next question. My pup Sammy has several small wart-like growths and would like to know and I guess they would like to know if they hurt him. Also, they make itch. He's on 5 Defender mushrooms and the growths have shrunk a bit, however, not gone. Thanks.
Generally, those little wart-like growths, which of course I don't really see what they are, so there's a couple of different categories that they can be, generally are benign. They can create problems if they get scratched at and can become infected, and depending what their location is, they may be annoying to the pup. But generally, we don't consider them a problem, except obviously cosmetically. You're looking at the dog or petting it. I think the 5 Defenders is a good choice, and it's great that they have actually shrunk a bit. Warts, are viral in origin, and so that might make sense because the same mushrooms that are in the 5 Defenders that are good for cancerous type growths are also good for viruses. So it could be that that's what's happening there. But I wouldn't worry about them. When I was in practice, we used to have pet parents come in and want me to remove a bunch of those, and unless we had a reason to put the animal under anesthesia for something else, like maybe they were going to be a dental or some other type of procedure, I generally recommended against generally doing that, including lipomas, those kind of little fatty jelly masses under the skin aren't usually to be removed.
Yeah, unless they get them, as you said, unless they interact with mobility or anything like that. Yeah, my little dog Scruffy has 2 warts. She's got one right on the top of her head. I call it her little old lady wart. And I just have to be careful because when she gets groomed, like,
they can bleed.
They do not shave her wart off.
And they can bleed too. So that can be concerning.
Yeah, yes, exactly. From Cautious Consumer, how do you know when warm compresses are better than cold ones? Good question.
Generally, cold is good for immediate, acute types of injuries, and warm is better for more chronic injuries that are still present month after month, week after week, month after month. That's the general rule.
Okay, good to know. Next question, can you discuss rabies shot injuries to dogs, specifically causing sarcoma in the injection site over the same spot and technically the wrong area in the hip bone area?
This is a concern. It first came to light in cats who apparently are more sensitive to these adverse effects, of the vaccinations. And I'm not one of those vets who says, yeah, all vaccinations are safe and you have to do them all. I think you need to pick and choose the vaccinations, and I think you need to base it on the risk in your environment. Where I am here in Colorado, we didn't have rabies for probably 15 years of my practice, but as with changes in climate, with the mobility of the population, we now have it in skunks, foxes, and bats locally to us. And so before I didn't vaccinate Ollie, but I think there is risk, so I do. But we are looking at some of the adjuvants that are in the vaccinations, mercury in particular, called thimerosal, as possibly being one cause for this. And we've changed where we give the injections, because if a sarcoma does arise, then we would want to it'd be a lot easier to remove it and not have it keep coming back. Because when we were giving them over the shoulder blade, it just goes into all that soft tissue, and they were virtually impossible to remove. I don't like the fact that these vaccinations do that, and I wish they didn't. At the same time, rabies is a nasty disease, and it affects people, and it's pretty fatal unless you catch it early enough. So you always have to balance the risk. Now, studies have been done. Now we have vaccines that are guaranteed to be good for 3 years. Dr. Gene Dodd, along with a professor of vaccinology at University of Wisconsin, Ron Schultz, did a long-term study and found that in most cases, especially if they were to get 2 rabies boosters early on, that they could go 5 years or more with protection. Now, I also would do, because I'm here in Boulder and a lot of people don't want to vaccinate their animals, and I understand it, we also can do titers. We can do titers for the distemper and parvo and all those guys. We can also do titers for the rabies vaccination, so we can estimate how much protection the animal actually has if it were exposed to rabies. And the only problem is that the legal authorities that are involved with making sure that animals are rabies protected, and they're rabies protected not so much for themselves as the human health hazard, but they won't accept the titers for rabies. So it depends on where you live and what the rules are and what the risks of exposure are. It's not an easy answer to that question, and I don't think there is any one right answer to it.
Yeah, and just the great answer, Rob. And just to add to that, I just moved back from Virginia to California, but in Virginia you weren't allowed to do titers. Rabies vaccines were mandatory, and I was very, very resistant. And then a rabid bobcat went into my neighbor's house and bit somebody. And then another neighbor actually died from rabies. So, it happens in real life. And so given that and and that my dog went, I have 5 acres of woods, and my dog ran through the woods, I did it, but I used some, I used Thuya, the
homeopathics can help to antidote it.
vaccinosis, and also the Adored Beast.
Mhm.
I have a product called Rebalancer that I also did. So I did the pre-prep, and then, and then just took really good care of her after it. I cried through the vaccine. But the other thing about vaccines is, and I'm curious what you think of this, Rob, we always, when I was working in hands-on practice, when we did have to give vaccines, and I worked in an integrative practice, we never gave like the 5-in-1 or the 3-in-1. We got the single vaccines so that we weren't loading so much at the same time.
Well, and that's what I tried to do with my clients in my practice as well. But for some people, it's inconvenient to keep coming in, which is one reason why they've got the all-in-ones. For myself, when I go in for a vaccination, I won't take the multiple vaccinations. Like this fall, we've got the flu vaccination, the COVID vaccination, and I'm traveling a lot. I'm going to be exposed in places that I normally live in a nice little farmette. I'm not exposed to much at all, but I'm going to be out there. So I want to figure out how to do it. I'm not going to get them at the same time. I'll probably get one and then wait a few weeks to get the other. Now, one more point that came to me, it's good we're having this conversation, is there was a study that was done with mushrooms, the oyster mushroom in particular, but any mushroom will work because of the beta glucans, in which they gave puppies the rabies vaccination, and they were unable to develop a protective titer. But then they found if they preconditioned them with the mushrooms first, like for a month, that they were able to get good protective titers. And I believe that if you were to precondition your puppy, start them as early as you can because they want to get those vaccinations in soon. I don't recommend vaccinating before 12 weeks of age, personally, unless the animal's in a very risky situation. But so start the animal on a mushroom. And 5 Defenders is a good choice, but any of the mushrooms are fine for that because of the beta glucan and what it can do to get the immune system trained to be able to maintain a long-standing memory of that vaccine. So that would be a very good way of connecting this question to mushrooms.
Exactly. And even though the study used oyster mushrooms, I've heard you say before, you think that the same reaction would happen really?
It was funded by an oyster mushroom company in Europe.
Yeah, well,
it's a proprietary that's called Pluran. But I think it was the beta glucans that did it. I don't think there's anything special. Oyster mushrooms are very special, but there's nothing more special about oyster mushrooms than any of the other mushrooms we have, like that beautiful reishi.
Yeah, up there, yeah. And actually, that I'm glad that you brought up that study, because I noticed in the chat earlier, I think it was Polymathing had a question for you about if you knew of any veterinary clinical studies. So there's one.
There's one, and that's it, really.
Well,
there are other studies, but not regarding mushrooms.
The Lion's Mane study. But they're few and far. Right.
I think she meant with reference to vaccinations, or no?
No, just studies in general.
Yeah. Okay. Yeah. No, that's kind of what we're doing is we're forging new territory here. And that's the reason why having so much feedback from pet parents who are giving mushrooms and from veterinarians who are using it clinically, which is what I'm working on, developing a core group of veterinarians that we can all share our information. This is where we get started developing, these objective references for mushroom use in animals.
And having said that, I was completely wrong. Polymathing's question was actually if you'd ever come across any historical references for medicinal fungal use. So a little different than a clinical study.
I have not. I used to have a text before the flood destroyed my house from the Ayurvedic tradition in India, and it had a lot of the indigenous plants, and I would assume that there probably was because for the use of herbs in animals in the history were always to keep animals that were used for food or beasts of burden healthy. And that's what the use of mushrooms were then as compared to our use in terms of they needed it because it was their food supply, and they used whatever they could to maintain the health of their food supply.
Yeah. I don't know. This is a very sideways historical reference, but I'm thinking of the stoned ape theory, the possible historic use of mushrooms by apes to kind of psilocybin by apes to kind of accelerate our development, as humans. But anyway.
Yeah, well, it's a good theory, and we'll talk about it for another meeting.
Yes, exactly. So Sarah is saying my Yorkie girl recently had a cranial crucial ligament tear. What can help? Sorry about that.
Yeah, well, fortunately she's light, so the forces of gravity on that bad knee aren't so great, and there can be orthotics and braces that you can get that can help to take the weight off of that while it heals. Depending on the nature of the tear, the healing process could create inflammation in the joint, which over time could lead to arthritis. So it might be worthwhile to look at what can be done surgically to stabilize that knee, or possibly to stabilize it externally, like with a brace, while it's healing, and then using mushrooms that would have anti-inflammatory and anti-pain content, like reishi or cordyceps. Cordyceps is very palatable. Reishi's in our 5 defenders. Reishi's not that palatable, but we do have it in small capsules. So it depends on how easy your little girl is in terms of accepting things and which specific mushroom would be easiest to get into her. But I think those 2 mushrooms in particular have impressed me. Mitotic as well, as having studies at least that show that it does have analgesic properties.
Yeah. Yeah, and I just I'm thinking of it from a rehab background.
Yeah, it's great to have you here with that background too.
When I hear this, I'm actually, first of all, I'm surprised that a Yorkie sustained a cruciate tear. It's actually pretty rare in these little dogs, or at least compared to how it seems to happen all the time with larger dogs these days. And I would say that as far as because she's so little, you really want to look at the age. If she's an older dog, you might want to just let that kind of scar up, basically. But if she's young and active, it might be something where you want to consider surgery. But braces work really, really well. Also,
my experience with Yorkies that develop this injury is oftentimes there may be an interaction between toenails that are a bit too long and there's like a rotational type of an injury. And they make a quick turn, and their foot's planted and doesn't move, doesn't pick up, and then they make a movement, and that could cause it.
Yeah, or a dew claw, or something related to a luxating patella.
Yeah, that too.
Something like that, because we see tons of luxating patellas in these smaller dogs, for sure. Yeah. Well, good luck to you with that, Sarah. Susan is asking, what type of mushroom should I give my 72-pound golden that is in remission from large cell lymphoma? Congratulations on that remission.
But we need to keep it there. And what we know with lymphoma, especially if you were using chemotherapy, is that eventually it does seem to come back, because the cancer cells usually live in the bone marrow. That's why in humans they do bone marrow transplants. So my suggestion would be, and I don't mean to sound like a broken record, but I think using something like the 5 defenders that has 5 different mushrooms in it, so you get kind of a shotgun approach, and you get the reishi, and you get the chaga, and you get the turkey tail, and you get the maitake and shiitake, all of which have good evidence and potency towards cancer and lymphoma as well. So I'd go with that.
Yeah. Sounds like a good plan. And
there were some good studies with cordyceps as well for lymphoma. So but a 72-pound golden is going to have issues with palatability, at least most of the time.
Speaking of that, there was also a maitake lymphoma study, was there not?
Well, yes. It was in dogs, And they started with in vitro, which means they did it in a test tube, which is a little questionable about why that was working, because there were no immune cells in there, which is how beta glucans get to cancers. Beta glucans, which are the main immune modulating part of a mushroom, stimulate your own immune system to attack the cancer. But we did see good benefits for maitake with lymphoma, but then when they went to do an actual clinical trial in real dogs with real lymphoma, it didn't do so well. But the trial was also flawed. So I would still consider maitake for that, certainly.
Yeah.
And so we have maitake in Five Defenders.
And we also have a single maitake powder as well that a lot of people don't know that we carry. It's kind of a it kind of appeared on our website. We haven't done a whole lot of marketing around it, but we actually do carry a maitake powder.
Maitake powder.
Olive green. That's a powder all over Rob's floor. Alrighty. Next question is lion's mane good for chronic arthritic or post-injury pain?
Again, we don't necessarily think about mushrooms as being, the mushroom to use for this. I think using lion's mane would be fine. I think it's got great anti-inflammatory activity. It might be better with a more of a neuropathic kind of a pain because of its effect on the nervous system, as compared to more of an osteoarthritic sort of a pain. But I would say, yeah, I would use it. I would probably try to get the dosage to escalate. There are, of course, other benefits for that as well. Chronic arthritic dogs may be older and may have a little touch of sundowners too. So in that case, you might be able to take care of several problems with one mushroom.
And that's a good point.
Mm-hmm.
And the next question from Michelle, what mushroom would you suggest for autoimmune disease for cats?
So if you could get reishi into your cat, I think that has the best evidence in terms of the studies. But given that may be the impossible dream, I would look at lion's mane or I would look at cordyceps, both of which are palatable enough for a kitty cat to eat. That's what I would suggest. Now, I think we have to be careful with not dosing too high too quickly, and we need to observe as we're applying the mushroom and watching it as we escalate the dose to look at whatever the symptoms are of the autoimmune disease to see if they're better or worse. Because autoimmune disease is like pains. There's a lot of different types of it. So, some types of autoimmune disease could be sensitive to mushrooms in a bad way. So you got to take it. And I'm not saying that to dissuade you from using it. I'm just saying start slow, go low, keep observing, and if it looks like it's not doing what you wanted to do, stop it. Maybe try a different mushroom, or maybe mushrooms just aren't in the picture for your pet.
Yeah. And to just fill in a little bit of the blanks, reishi is a bitter mushroom. It's the most bitter of all of our mushrooms. That's why Doc Rob was saying like it would be a wishful thinking that a cat would eat the reishi, and some do.
That was a bit glib, but bitter's better actually.
That's where the medicine is, and the bitterness. But animals instinctively avoid bitter because often bitter things are poisonous things. Am I saying that correctly, Rob?
Yeah, you are. And I perhaps have been a bit too hard on the palatability of mushrooms in terms of the bitterness, because as I'm out there talking to a lot of different people all the time, I'm finding more and more pets will accept reishi.
My cat loves reishi. I know, I hear it all the time. Like the 8 cats that ate the immune chews, I would not have thought that they would do that because the relaxed chews you have catnip in, but the immune chews.
Yeah, I know. Go figure.
And that's, are they drawn to the blueberry powder? I don't know, but yeah, so go figure.
Yeah.
Yeah. So the next one from Chris. My dog is a 130-pound Rottweiler, May 10th, diagnosed with bone and lung cancer. Vet said his max expiration date was 2 weeks after diagnosis. I've been treating him with panacur, 3 days on, 4 days off, along with CBD oil and 95% curcumin, which is turmeric. Started turkey tail mushroom capsules 2 weeks ago. Is there anything else I can do for him? He's still doing fantastic. Wouldn't know anything was wrong with him except for the swelling on his front ankle. Oh, goodness.
Well, I think the turkey tail is a good choice. and I would look to, I mean, 130 pounds is a lot of dog.
God.
So, I would try to escalate that pretty high. Um, and hopefully it's our turkey tail because that's really the most
Yeah.
potent out there, in my belief, in the marketplace. There are some Chinese herbs that one could use for this. Um, and I'm wondering when you say bone and lung cancer, if maybe we're dealing with metastases to the
Plastic.
lungs
Yeah.
from an
Sure.
osteosarcoma in his
Yeah.
ankle, which is common in Rottweilers. But there are some Chinese herbs for this as well, which I have available. I have those available on my own website, and if you reached out to me, I'd be happy to try to get you hooked up with some stuff that would work. But I think you're doing pretty good. And the panacur is kind of a pretty exciting new treatment. That this is a wormer that we're finding, and also we use it for Giardia, but now it also apparently has benefit for cancer. So that's awesome.
Interesting. I have a question here, Doc Rob. Like so let's say it is bone cancer that has metastasized to the lungs. Would cordyceps still potentially be helpful for the lungs just to help with lung function, even though
Cordyceps would be great for this as well because of that lung problem. I'm sorry to say that once a tumor spreads from its original location, it just becomes that much more difficult to deal with. So you got to bring out everything, including the kitchen sink. So far, doing pretty well. And May is like what? June, July. That's 4 months. I mean, that's pretty good.
incredible. Yeah, yeah. I mean, 2 weeks, 4 months. You've gotten 4 months, and it sounds like he's he's having a good quality of life. So good for you. You're in our prayers. All right, what's our next one? Our next question, Britta. And I want to also give a shout out. So we have Britta Berube, who is my assistant. Well, me and Rob's assistant is. It's her first night behind the scenes, loading the questions. She's going to be helping us out. Jordan's back there too. Hey guys, we're so happy to have you there. And Britta's going to be taking over these pet Q&As. Maybe one of these days we'll bring her up in the front. I'll take the night off or something. But anyway, thank you guys. Next question from Bridget. What's the difference between Daily Dog versus 5 Defenders? Is one better than the other?
Well, they both have really different intentions, I think, is the way to look at it. And I designed Daily Dog. I didn't design 5 Defenders, but I could have because it's an excellent formula. And my idea behind Daily Dog was to create sort of a wellness product, something that people could use easily every day. It has more than mushrooms in it and things like probiotics and kind of an all-in-one sort of approach. And we generally recommend dosing that relatively low because they don't need a lot for that daily wellness with the potent ingredients that are in there. 5 Defenders can also be used similarly in that wellness approach. In fact, Daily Dog contains the 5 Defenders plus lion's mane and cordyceps, but not at the same levels that you could get to if you were just using the 5 Defenders alone. So, if you just wanted a daily wellness product, probably Daily Dog has got more bells and whistles to it. But if you had some reason to treat something that was more serious than daily wellness, then I would reach for the 5 Defenders.
Yeah. I have to say, I'm slightly obsessed with the Daily Dog. I'm loving it. I think I'm on when did it come out? I don't know how many. I've probably been through like almost a dozen bottles at this point with my little dog, Scruffy. She loves it. And I don't know what it is. Everybody comments on how soft her coat is. It's like everyone that pets her these days, it's like, my gosh, because her name is Scruffy. She's like her coat looks
dry.
And when you pet it, it's just the coat does not feel like it. And this is kind of new. And she's going on 13 years old. So the only thing that I've done is added the Daily Dog because I was doing all the other mushrooms. So I don't know for sure, but I like to think that the Daily Dog is really supporting her coat health.
Does she get fatty acids as well, Joni?
She does. I give her sardines. She gets sardines a couple nights a week. So, and that's been forever. I mean, I've been giving her fish and different kinds of oils and stuff. So no, really the change. The only nothing in her diet has changed except for adding the daily dawg. So, no clinical study here, just a
Yeah.
observation. So anyway, and Ms. Kimball's asking about your book.
Oh,
That.
well,
Well,
what book are you referring
that
to?
book. Woo!
So, to answer your question, Miss Kibbles, I'll have a copy with me, several copies with me. They're not for sale yet. That's a proof copy. We've got about 100 different little minor things we have to correct before we can get it printed, and then we'll have it available for sale in a variety of different venues. Thank you for mentioning that, though.
Yeah, and I just have to I'm so excited, and I just want to brag for you. Like, it's just, the book is it's so thick. I love the cover, but my favorite part of the book is the back of the book and all of the wonderful endorsements you've gotten on the back of the book. Dr. Karen Becker, Dr. Judy Morgan. You've gotten endorsements from Dr. Eeyore Basco,
Marty Goldstein,
Carol, Mark Plotkin. I mean, like, everybody who knows anything about mushrooms have fully endorsed Rob's book, which, I mean, I'm not at all surprised. You're brilliant, and it's like this book's taken you 3 years to put together, and finally coming to fruition. Yeah.
What I think is really good about it, though, and I added this after I wrote it the first time and looked at it and said, this is not exactly what I want. I added stories, from patients I've seen, and talked about their problems and how I addressed them. And so a lot of the information is very much like what I'm saying here, as far as, if you like my wisdom regarding these different issues we're discussing, it's embedded in the book as well. And so I cover arthritis, allergies, what else do I have? Anxiety, cancer, digestive problems, epilepsy, and wellness.
Yeah. And I've seen, you sent me kind of the rough draft before I went to the printer, and I was so impressed.
Thank you.
It's really going to become a reference for people. And people will be able to pre-order it. I'm at some of these events.
We have it set up on the website, and I'm going to bring some postcards with me to these events that have scan tags on them, and I'll probably start inserting some scan tags into slides as well. And then once it's actually for sale, we'll expand the scan tag so people can find it in a variety of places.
Wonderful. And then for anyone that's a veterinary professional, Rob also has a mushroom course that's just come out through the College of Integrative Veterinary Therapies. It's a 6-week course, and it launches next Tuesday. So,
it's 6 modules. I think it could take someone a lot longer than 6 weeks.
Yeah.
It's got lecture notes. It's got associated full text citations that we're going to require the vets to do case reports, and we're going to ask reviews of. We're going to ask vets to actually do case reports from their own patients as well, as part of their fulfillment for the 10 CE credits that they'll get if they complete the course.
Yeah. And I want to give a shout out to Dee Mankowski she has a wonderful Facebook page called Pawformative. She's asking of Orlando event. So yes, you will have the book, at least the QR codes, the pre-order available.
Orlando, I sure hope so. But I'll have information by then, and I'll have samples of the book so you can look through it. And don't take Joni's word for it or my word for it. Check it out.
I lie all the time now.
No, I'm more modest about promoting myself, Joni, and so it's nice to have Joni to kind of say the things that I'm not going to say about myself.
Yeah. I'm very excited for you and
you.
for us, because it was just a few years ago when I started working with mushrooms back in 2020, and I was looking for veterinary resources. And of course, Dr. Eeyore Basco, who was, an amazing vet out of Hawaii, he wrote a small mushroom book, very excellent book, wonderful recipes, great tips and stuff. And I think yours is more comprehensive, and with monographs and details, etc.
Well, and it's updated. We do have a couple of studies that I get to talk about, that sort of thing. But no, Ihor really, in many ways, is my mentor with mushrooms, and he introduced the concept of mushrooms to the veterinary group maybe 25 years ago.
Yes.
And that's got all of our attention. And then since then, we've all been building up on our use of mushrooms clinically.
Yeah, absolutely.
And I'm going to see him in person at the end of October. We're going on the Eugene Mushroom Festival is happening at the end of October, and so a bunch of us from the Veterinary Botanical and Medical Association, we're doing what we call an eco tour. So we're like 25 veterinary herbalists are all getting together. We're gonna go to the festival, then we're going to go into the forests and stay at a hot springs and find mushrooms and have a hell of a good time.
Yeah, so anyone, if you're up in the Pacific Northwest and check out the Mushroom Festival, you'll see a bunch of veterinarians running around with mushrooms. Alrighty, back to the questions from Christy. Do dogs build up a tolerance to mushrooms, making them less effective over time? Great question.
Mushrooms are more effective over time, and there's no need to take a day or two off or to rotate, other than to just allow the benefits of a different mushroom to work for your animal, or explore the value of one mushroom over another. But there is something that we've discovered, which is very interesting, that when you use mushrooms for a long period of time, it actually trains your immune system to have a better memory for many of the things that your immune system is protecting you against, because of the influence of these beta glucans on the animal's immune system. So no, I wouldn't worry about that at all, Kristen.
If I'm just going to give you a little bit of a contrary answer, just because I agree with you, Doc Rob. I also, I think back to, it was actually Dr. Kelleher on a roundtable mentioning that often, like if she is treating an animal who has a aggressive disease that begins with C, and they've been doing well on a particular mushroom for a few years, sometimes she'll switch to a different medicinal mushroom after a period of time that she finds that that's helpful. I've had another veterinarian say that too. Whether or not I
don't disagree with that at all. I think that there's nothing wrong with changing around, and I think that the mushrooms have so many of the same benefits amongst them, especially with regards to the immune system and the big C and things like that. But that's also the value of these multiple mushroom formulas, where you get this synergy among the different mushrooms that are there. So I think there's lots of choices out there, and we don't have really clear-cut answers that have been objectively determined. But I think that the concept of not stopping it is important. Changing to a different one, that may be cool.
Yeah. I do want to address the question from Anne about the cordyceps powder that's in the chat. Because Ann Johnson, who's asking, she says she didn't see the cordyceps powder. Britta, I don't know if you can see that one there. But I do think that just to let everybody know, if you go on our website in the pet section and are looking for a powder and don't see it, it's still available. It's just on the larger website. You can still find the powder. It just might not be under the pets link. And that's for compliance purposes.
Yeah, it's an FDA thing. FDA does not like to have us sell a product that is labeled for human use under a tab that is designated for pet use, and vice versa. We don't sell our pet products for human use, but certainly if you had a child that could use a 300 milligram capsule versus a 500 milligram capsule, then, again, so it's okay. I mean, just go to the human tab and you'll get what you need.
Yeah. It's also, we're in the process of getting our certification with the NASC, the National Animal Supplement Council, which is a very highly regarded organization that certifies the quality of supplements. It's a rigorous, we've been working on the certification for over a year now. And as part of that certification, we have to really be in compliance. So so we still have all the mushrooms. You just might not find them in the same place on the website. Yeah. So Cautious Consumer is asking, is mushroom Uh, is mushroom powder better than mushroom tinctures? Why or why not?
Well, I think it's wrong to think in terms of better or worse. I
Mhm.
think they have different applications, and a lot of it depends on how the tincture is put together. But because the tincture is so much liquid, you can't really get as much potency from a tincture that you might get from a powder. For instance, a starting dosage for a powder for an animal, it's an eighth of a teaspoon per 10 pounds of body weight. That's not much. Whereas to get a similar amount of beta glucans into an animal with a liquid, it might take an ml of liquid or might even take more. So, but I think there's certain animals for which the liquid is definitely more
Absolutely.
preferred and easier to give, and others that the powder is fine as well. But that's also why I talk so much about palatability, because and that's what I've learned as a veterinarian. That's what I've learned as a product formulator, which is that if you can't get it into the animal in an easy way, it's not going to happen. You may be fighting, be okay fighting that animal for a couple of weeks, but getting that, this is showing you putting a capsule in the animal's mouth for a couple of weeks. But if the real benefit of mushrooms is long term, it's got to be easy. It's got to be something that's part of your lifestyle to make it part of the animal's lifestyle.
Yeah. And it's also, yeah, no, I completely agree. And it's also a matter of like, it's such a, like, you really can't answer that question because it really goes back to how are these products made? Because a mushroom powder, if you just take mushrooms and just grind them up, they're not going to be as good as a very high quality, a tincture that's extracted in the correct way. And, you know, so you really have to look at how
Very
each product is made. One thing about tinctures is that they're easier to, there are a lot more tinctures out there, I think, in the marketplace because they are easier. It's easier to get into the mushroom into mushroom products
mm-hmm.
in a liquid form to make a quality one. Like the powders, takes a long time to grow our mushrooms. And we, 35 years of research and development to make our powders correctly. I hope I said that the right way.
You think about, the tinctures, maybe they're easier because you can put them in the mouth and squirt it in, but is that really easier than putting an eighth of a teaspoon in some food that the animal eats every day that is palatable enough they don't even notice it? So, I think there's so many different situations out there, and it's good that we have a lot of choices as far as how to address each different situation.
There's some great tincture companies out there. I recommend tinctures all the time. So, yeah.
Very good.
Let's see. Oh, we got just a couple minutes left.
Time flies when you're having fun.
Question. Annette's saying, I accidentally ordered 5 Defender for human consumption for my dog. First time ordered the one for dogs. The one for dogs says not for human consumption. Well,
yeah, and that's what we were saying. That's the FDA makes us put that on the container, not because there's anything in there that a human can't take, but because they don't want to have things mixed up. And that goes way back to the fact that animals originally, according to the FDA, were used for food, were part of the human food chain. So the FDA doesn't really have it well put together to deal with animals that are companion animals as compared to food animals. So the same rules hold true, not just for cows, but for cats too, so don't worry about it, don't worry about it.
It's just legal stuff we have to put on there, basically. You want to do, we got time for one more question. The lightning round. Are there any? Okay, Marianne. My 12-year-old Springer Spaniel was just diagnosed with transitional cell carcinoma of the bladder. She is taking piroxicam 5 milligrams daily. I'm giving her 5 Defenders to help battle the cancer, but I'm wondering about something that might be protective of the GI system and kidneys.
Well, I would say looking at cordyceps, hi Scruffy, cordyceps as far as the kidneys, and also could be good as far as the cancer, and and chaga actually because of the bladder. Chaga concentrates in the bladder. We know it's good for that, as well as for upper GI, which might help. The piroxicam, as a very strong NSAID, can cause some gastritis in some pets. So we oftentimes recommend giving it Pepsid or something similar, giving it with food. So stomach lining is protected. So chaga
Yeah,
Private vendor has the chaga in it, so it also has the other anti-cancer properties.
yeah, for some reason your audio cut in and out there.
Maybe moving back and forth.
Part of it, but the chaga and cordyceps is what you were recommending. And yeah, I'm so sorry. I had a dog that had TCC, and it was tough.
Yeah, it depends what the tumor is as far as how they do, and Chinese herbs can also be very helpful. Sometimes transitional cell tumors are very, very slow growing, and animals can live with them if they're not in the wrong place in the bladder for a long period of time. You might just think they're having chronic UTIs.
Yeah, but there's a lot of it's
But it can get nasty.
constant urination and having to cover the floors and all it's.
Yeah.
I'm remembering all that, and I'm feeling for you. Pet Love 25. That's our code tonight for 25% off site-wide until September 30th. So if you want to take a screenshot of that, Pet Love 25. And yeah, we're at the well, at least on the Pacific time, the 5 o'clock mark. So that went by fast.
Yeah, I have to say I get disappointed when these things are over. I have a lot of fun. It's nice being people actually listening to me for a change.
Yeah, this is Scruffy. It's her first Facebook Live. But, yeah, this is my baby doll, my heart. She's like, it's time for us to go on our walk because I've been in meetings all day. She's like, okay, Mom, time to get off the computer. So, Rob, always a pleasure spending time with you. And to everybody, what a great, lots of great questions. And
really,
yeah, can't wait. Gosh, Rob will be at Chicago, the Ruth Roberts event this weekend. The following weekend is going to be at Miss Kibble's, the Northern Virginia Miss Kibble's event. And then the following weekend, we're going to, that's a Lee Carroll event in Berkeley, and then AHBMA. And then I'll be down at the Feed Reel event. And then there's the Dr. Judy event in Florida. So yeah, our heads are going to be spinning, and we hope to see a lot of you at various events over the next few weeks. So
definitely.
Yeah. All righty, everybody. Oh, and thanks, Britta and Jordan again.
Bye all.
Bye-bye.